Oh no! Oh no! You
Welcome back. Welcome back.
You use a push mower.
I do.
But Mike over here, we're taking a poll. Mike doesn't use a push mower.
Well, he has 3
but
acres.
You have 3 acres.
Almost 3, yeah.
Yeah.
So
Do you have one of those big bad boys with the levers in the front?
I'm too cheap. I'm too cheap.
Oh, you're too cheap. So you have the
just
regular.
old American made, yeah.
Yeah. Okay.
Yeah. Don't pay anybody to do it. They salivate over my yard. It's a big yard.
So you don't have a 0 turning radius
No,
mower?
too cheap.
You have
Too
one that
cheap.
has reverse. You pull up, reverse.
Right.
Pull back.
I say frugal. My wife says cheap. So.
Okay.
Well, I like that, but I'm telling you, there was a guy mowing in our neighborhood the other day with one of those big. I mean, you should have seen it. I mean, he's like, it's
Oh,
like
yeah.
Oh, yeah, they're
spinning
neat.
and flipping.
They're really
He
neat.
mowed our neighbor's yard in like 15 minutes.
Yeah.
Oh, that's
I
where he
mean,
makes
he
his
really
money.
fast.
Came out thinking,
Yeah.
he's
Yeah,
done.
you see them at the hospital and at the college, and
Yeah.
they'll clear a few acres in no time at all.
Oh yeah.
As long as your feet are in good shape, you can mow,
That's-
right, Doctor?
That's right. That's right. It's
I
all
have a 0
part.
radius turn.
It's all part of.
Is that what you have?
Yeah, that's what I have.
That's right. Yeah, he's trying to save his feet and ankles. Are you kidding?
I bet.
right.
Bet
But
you
it's
are.
all part of the Human Motion Institute, right?
Absolutely.
'Cause
Absolutely.
You were
Nose to
hitting me
toes.
with the HMI. So we've had one of the sports medicine, Dr.
Dr. Wallace was
Dr.
here.
Wallace was on here, so we did sports medicine, and we've done the contraption lady. She's been on here a couple times. And what
Yes.
new contraption
Yes,
did you
Crystal
see
Henry.
and tell me about that I just
Yeah, I was in an orthopedist office yesterday, and I don't think it's a joke. I'm gonna go back and revisit it since we're laughing about it. But I'm pretty. It looked for real.
I'm
real
sure the
to me.
orthopedist is going, it's not a joke, Mike.
Yeah, it looked real to me. And it didn't seem to be a spoof, but it looks like a brace that goes from mid-arm down to your fingers and includes your thumb. And it had a picture of somebody holding a phone and texting as if
Oh,
to reference,
really?
repetitive motion injuries with your thumb. So
I can just see 14-year-olds all over America
Yeah.
with it.
I guess I have a friend, and this is a true story, I have a friend who claims that his daughter in 1 month, I believe, texted over 17,000 times, and I did the math and I forget what it was, but I mean it was doable, but it had to be just a job
I
every
would
day.
say
And I
those
just-
numbers seem outlandish, but no, it's constant.
And even now, my wife will text somebody, and it'll go on for 20 minutes when you could have a 3-minute conversation to be done.
Yeah,
with
it's
it.
kind of
So,
strange.
Yeah.
I am my father's son.
Yeah, wouldn't it be nice just to go visit people, and sit down
yeah,
and
the
chit
front
chat?
porch kind of
Yeah,
thing.
that kind of thing.
Absolutely.
I sit on my front porch. But now tell us first about the Human Motion Institute, because some people might be watching today
Well,
that,
sure.
that don't know
Well, sure.
what that is yet. So
Sure.
give us an intro first.
Well, about a year ago, a little over a year ago, we entered into an agreement with a company out of Pittsburgh, and they're helping us develop, and we're almost to the end of that phase of developing the service line. And it's an industry standard, and what we do is take all elements that fall into orthopedics. We deal with contracts, we deal with administrative issues, operative issues, and then work with the physicians, their offices, and surgery, physical therapy, anything and everything that touch orthopedics. Again, kind of a cliche, but nose to toes. And we make sure, number one, we're doing the right thing for the patients, but also as an organization, we want to run everything as smoothly and as efficiently as possible.
So more seamless for the
Absolutely,
patient, so they
absolutely,
don't really, they don't have
absolutely.
to start here and then be told they need to go back over there.
Right, right. You know, and just one small example of that is we have for our total joints, our total hips and total knees, we have a preoperative education class. And we have, it seems like a no-brainer, but at the time, number one, we didn't have pre-op education years ago, but now we've made that preoperative education class to coincide with people coming in and having their preoperative testing, so they can come in, go to the class, teaches them a lot about what to expect, but also while they're there, get their testing and all that done, so they don't have to come back 2 or 3 times.
Oh, that's nice.
Well, introduce Eric here and tell us about the importance of what he does
Well, sure.
for the Human Motion Institute.
Within Human Motion Institute, we work with 8 physicians, and Dr. Arp is one of them. He's our only surgical podiatrist, and to my knowledge, one of the very few in the region. They're, as my dad would say, they're harder to find than hen's teeth. Matter of fact, I was out visiting in Ash Flat here a couple months ago with a physician, and they wanted him and his wife to set up a satellite clinic there. And I called Kathy Arp there in the office and was talking to her, and she said, you know, we can't. You know, we're so busy in Mountain Home, and they have patients, and he can reference this a little bit, but they have patients come in from hours, you know, certainly an hour and more away all the time, every day.
You know, a person like you that moves into a small community like this, is in high demand, and you know, it's interesting to me why you did move here. Can you kind of touch on that a little bit?
Well, the area brought me here, the lakes, which we saw the first week we came, and I haven't seen them since.
Yeah.
You're like, I know they're out there somewhere.
We've had a steady flow through the door, and we work 5 days a week. And
no wonder you have a zero turning radius mower, so you can get in there and get it done.
You can bolt around trees.
I bet.
But, well, I have a podiatrist. Does that mean you just work like from the knee down? Is that I mean,
right? Yeah, it's a foot and ankle.
Just solely
I do
foot
ankle fusions, do bunions, do midfoot, do rear foot, any kind of tendon work, any kind of surgery of the foot and the ankle.
Yeah, even something like a bad toenail. I mean, everything from something as minor as that to ankle complete.
Yes, the fusion or a tendon transfer, dropped arch. And a tendon transfer with that, and really anything. I'm board certified, and I go to classes and cadaver workshops and etc. Continuing education and all that. So I can handle it all.
Yeah. Well, I guess this is a plug for podiatrists because I'm a runner, as everybody watches the show knows, and I've been told by orthopedic surgeons, chiropractors, everybody else, it starts with your feet. It's all. If there's something wrong here, it'll show up here. It'll show up here, it'll show up here, and then it'll show up in your neck.
Yeah.
Exactly. That's what my chiropractor told me.
Absolutely.
He said, if you've got good feet and you take good care of your feet, Sandy, you'll be able to run forever.
Right. Yeah, absolutely. With running, I mean, you got a flat arch, you got a high arch. You know, everybody's got a foot type, so you've got to accommodate the structure that you have. And if you've got a flat arch, it's going to internally rotate your knee. It's going to go to your hip, to your back. So you get an orthotic or an insert, custom insert that braces you up.
Now, do you make those?
Yes.
So someone would come to you if they needed something
yes,
like
we'd
that?
mold them, send them to a specialist that makes them. They'll send it back, and we'll fit it in your shoe. But we make the mold for that. But those are part of the things biomechanically you can do to stop problems. Overuse injuries is what we're talking about here is with running. So that's part of what I do. I also see a lot of common congenital problems, which are, I brought this foot model here, but a bunion is something that sticks out on the side, and we fix those. Heel pain.
Are those hereditary?
Bunions are hereditary. Shoes aggravate them, but they do not cause them.
Does that have to be corrected with surgery?
A bunion will either stay the same or get worse. It won't ever get better on its own. If it's a painful bunion, then you look into surgical options. If it's not a painful bunion, then you can leave it alone.
Yeah, but that's a very common.
Very common.
Very, very common. What about corns and just crazy things like that? Are those?
Corn is a bone problem, usually with a toe that's sticking up like that, or hits the shoe. Toe versus shoe, the toe always loses, so that usually produces a corn. And that has to be solved with correcting the bony problem, not the skin problem.
And most people they just buy those little pads, and so it's not.
It's a bone problem.
That's how do you fix the bone problem?
You just shave a little bit off, or you
cut
realign
the bone
it.
off.
Yeah, you can either cut the bone, or you can cut the bone in half a little bit to move it over and pin it in a proper position. Most of us don't have a perfect foot. We have little malalignments that make things difficult with shoes or running or overuse injuries, it cause tendonitis, etc. So musculoskeletally, you've got to reposition that in a proper position to function, and that would be part of that. It may be a simple little bump that you nip off, or it may be a toe that needs to be repositioned, or it may be a tendon in the ankle that needs to be reconstructed. It just varies, but heel pain is a very common problem with runners. A heel spur that forms on the bottom, but it's usually...
And that's from overuse too?
Overuse, yeah. It's a little tear of the ligament. It's a very common problem I see in the summer, especially when people start walking.
Yeah. What about that plantar fascialis?
That's
what is
plantar
that?
fasciitis.
Okay.
That's
I've
what that is.
I've had several people say, oh, if you ever have that, you'll know it.
Oh, absolutely. First step in the morning's the worst.
Is that just a shortness of the Achilles tendon or something?
Well, it's a band on the bottom of the foot. The Achilles tendon comes off the back here.
Okay.
And the band on the bottom holds the arch up.
So
like
it just
that.
kind of wraps around there.
And that, where it attaches to the heel bone, tears.
Okay.
And then it's a vicious cycle of re-injury. And usually people will come in about 3 months, 4 months and said, okay, I'm throwing the towel in, it's not going away.
Yeah.
It starts slowly. They try to figure out why it happened, but they can't. Usually they step on a rock or you twist it just right, you make a micro tear, and then
So
it's a vicious
not a genetic
cycle.
thing, it's an actual injury?
It's an injury,
It's
absolutely.
An injury.
It's an injury, and it's a vicious cycle that forms, and over time it will thicken the ligament, the structure of it itself, and it takes about 3-4 months sometimes to get rid of it with treatment. Usually when I see people, it's been 3 months up to a year for some people.